The context for this panel was really to talk about the fact that, even though Pranay said he doesn't want to disrupt, there are other companies that are coming into the industry and trying very hard to disrupt. So what I wanted to do is assemble this panel of experts and health system leaders to really, talk through what do these challenges mean to them? What should we be thinking about as health systems, or what should all of you be thinking about as health systems out there? And what should we be thinking about as your partner in working to try to adjust these challenges? And, what are they doing to, frankly, really galvanize their organizations to try to drive change quickly? So why don't we just jump in? Tom, like I said, you've studied health system strategy for a long time. You've studied digital health market moves now for 3 years. Should health systems be concerned about these disruptors?
Yes. So I guess that is slightly different. I think whether it is the kind of upstart kind of entrepreneurs, notable being one of them, who are kind of partners, or it is the Amazons or the Walmarts or the CVSs of the world. It all comes down to one thing, which is it doesn't matter how much money you have, it doesn't matter how talented you are, how you treat people makes all the difference in the world. Two things we talked about yesterday. Workforce. Your workforce is leaving you. And these organizations are overpaying to speed that up. Two, patients. The vast majority of the organizations in this room generate the vast majority of their revenue from things that people don't get to choose. So inpatient stays, complex cases. Where you have relationships is when people are people before they become patients, and when people are really looking for a trusted relationship. And that's not what health systems have been excellent at historically.
Caroline, I'm just curious, when you think about where MUSC is today and where you think about where you are making investments in external partnerships, what are you trying to do to give yourself competitive advantage in your market and to address this threat as it comes up?
Yeah. Well, hopefully I can at least be a little bit of sunshine to some of Tom's comments. But no, what I would say is that health systems and provider organizations more broadly probably have 3 major competitive advantages that we need to continue to capitalize on. And I think capitalizing on them isn't going to be enough. We're also going to have to lean into digital transformation to kind of address some of these issues. But the first thing is trust. We ran a whole marketing campaign at MUSC last year, kind of post-pandemic. Trust is strong medicine. And patients want a relationship with a provider. And although we had some erosion of that during the pandemic, unfortunately, I think for the most part, most patients still rely on their MD for their primary expertise on both health and disease. And so I think we really have to lean into that as provider organizations and health systems and remember how critical that relationship is and how much that can help us. The second thing is really around infrastructure and talent. Healthcare is an expensive and complex business, right? And it requires a lot of equipment, a lot of complex facilities, and a lot of really smart, highly educated, highly specialized people. The last thing, it goes back to our business complexity. Healthcare is an incredibly complex structure, and it's only getting more and more complex in some ways. And I think we saw big hitters like JP Morgan and others say, we're going to get into healthcare and then promptly exit, right? So health systems have an incredible competitive advantage because we understand how the business works.
Adam, is that consistent with what you're hearing at KLAS? And you go out and sort of understand what everyone's thinking about in terms of digital engagement and what does the alignment look like?
Yeah, I think that's the key word, alignment. And it's interesting because historically, KLAS talks to our provider friends and says, tell us what you think of this vendor, this product. And we have started to interview patients and said, well, what do you think? And they don't rate vendors at this point, but just asking their preferences and technology, I think it maps nicely to what we're already saying here. The disruption is here, and to lean into the disruption is the right approach. So we went out, we interviewed patients from 49 of the states, and this is what they told us. And there's two things I hope you'll take away from this. Look at the disparities between what patients told us they want and where generally vendors focus and what providers are focused on. And we know there's specialists that do a lot of these things, but there are some significant disparities there, what the priorities are. I also want you to look at the top half of the chart, what patients said are most important to them. They want access, they want convenience. I don't think that's shocking. I think all of us as patients could say, yeah, I need that as well. So this really painted a picture for us where we need to focus our research, and we're double clicking on some of these priorities for patients for that reason. I want to show you one other thing, Carly. So we asked patients, okay, well, what are the factors you value most when choosing where to go? Appointment availability, highest priority, convenience of the location, ability to check in online or on the phone. So this is where I insert my Chick-fil-A commercial. I think Chick-fil-A knows me better than my doctor does. They have my payment method. They know my name. They know what I ordered last time. They bring it out to the blue Tacoma. They know me. So, but there's principles there that I think we can follow and lean into that disruption.
Yeah.
Realize this is where they want to go.
John, I have to turn to you because you guys jumped into really trying to understand patients from a population health perspective before anybody. Is this consistent with what you are hearing today and, with where you are trying to go at Montefiore?
The appointment scheduling, the registration, check-in, that's key. What we heard a lot yesterday was diverse patient population. I mean, we're in the Bronx. 80 to 85% of our revenue is government, highly Medicaid. So when we look for solutions, we don't need like an off-the-shelf solution. If we're looking for a solution where a patient has to log on to a portal, has to have high-speed internet, has to have an unlimited cell phone data. A lot of our patients don't have that. So what we're looking for is vendors who can think outside of the box and who can really be a strategic partner and a strategic think partner with us. And part of what we liked when we looked at Notable, we looked at other vendors as well for automation and AI and RPA. People were bringing us out of the box solutions to say, this is how you do revenue cycle. This is how you do quality. This is how you do a gap in care. But that's an out of the box solution. And what Notable did, they partnered with us. They shadowed our team. They looked at our workflows. They actually challenged our workflows. Like, do you really need to do this?
So, Tom, I'm going to come back to you. I don't know. I hear some good stuff going on here. Should they still be concerned? Come on.
100%. I mean, I think concern is the kind of flip side of urgency. And people do trust you. They trust your doctors and nurses. They just don't love you. And when you look at the convenience measures, the concern I have is people will still trust you when they're sick. But upstream of that, if they don't love you, there are other options.
thank you to our panelists. I just appreciate all your candor and the time you took to join us here today.
Thank you.